What are pineal region tumors explained? Imagine a tiny, almond-shaped gland deep inside your brain that helps regulate your sleep and wake cycles. That's the pineal gland. Although it's small, it can sometimes develop tumors, which are abnormal growths. These tumors in the area are called pineal region tumors, and they are quite rare. They make up less than 1% of all brain tumors in adults but can occur at any age, especially in children. Because they develop in such a deep part of the brain, they can be tricky to diagnose and treat. Pineal region tumors are a diverse group. They mainly fall into two categories based on where the tumor cells originate. The first group is germ cell tumors. These come from germ cells, which are embryonic reproductive cells that sometimes migrate abnormally during development. Common germ cell tumors in this region include germinomas, which are the most frequent, as well as choriocarcinomas, yolk sac tumors, teratomas, and mixed germ cell tumors. These tumors can sometimes produce hormones or cause other symptoms depending on their size and location. The second main group is pineal parenchymal tumors. These originate from the cells of the pineal gland itself. They include several types such as pinocytomas, which are slow-growing and tend to have a good outlook. Then there are tumors of intermediate differentiation, which are a bit more aggressive and may recur after treatment. More serious are papillary tumors, which are malignant and tend to grow faster. The most aggressive of these is pineoblastoma, a highly malignant tumor that can invade nearby brain tissue and even spread to the spinal cord. Tumors in this region are graded from 1 to 4, with 1 being the least aggressive and for the most. The grade helps doctors understand how quickly the tumor might grow and how best to treat it. Symptoms often happen because the tumor presses on nearby parts of the brain. This pressure can block the flow of cerebrospinal fluid, leading to increased pressure inside the skull, which causes headaches, nausea, or even swelling of the eyes. Tumors can also affect eye movements and pupil reflexes, leading to a condition called Perrineau syndrome, which causes difficulty looking up or down. Sometimes, if the tumor affects hormonal regulation, especially in boys, it can lead to early puberty. Diagnosing these tumors usually involves magnetic resonance imaging scans, which provide detailed pictures of the brain. Sometimes a biopsy is performed to analyze the tumor tissue directly. Computed tomography scans can also help by showing calcifications that are common in some tumors. Lumbar punctures are generally avoided because they can increase the risk of brain herniation in certain cases. Treatment depends on the specific type and grade of the tumor. Surgery might involve removing part or all of the tumor, but because of its location, sometimes only a biopsy is possible. Radiation therapy is often effective, especially for germ cell tumors like germinomas, which are very sensitive to radiation and often curable. More aggressive tumors like pineoblastomas usually requiring a combination of surgery, radiation, and chemotherapy to improve outcomes. Most pineal tumors develop without a clear cause. They are generally sporadic, meaning they happen by chance rather than due to lifestyle or environmental factors. Some genetic mutations or inherited syndromes can increase the risk, but these are rare. And like other types of cancer, lifestyle choices are not strongly linked to the development of pineal region tumors. In summary, pineal region tumors are a rare and complex group of brain tumors that develop in or around the pineal gland. They vary widely in their behavior and prognosis, from slow-growing benign tumors to highly malignant ones. Accurate diagnosis and personalized treatment plans are essential for managing these tumors effectively. If you or someone you know experiences symptoms like headaches, vision changes, or hormonal issues, it's important to consult a healthcare professional for proper evaluation and care.